Welcome to the Millcreek Government Channel. I'm Judy Zelina. Joining us on our program, we have a good friend of ours, Judy Halcomb, a familiar face.
Oh, I thought you were going to say an unfamiliar face. No.
A very familiar face.
Right.
And Judy is a registered nurse who keeps trying to retire.
Yes. Soon coming up. Still working on it, Judy.
Not happening, Judy.
Yeah.
But anyhow, we're so glad to have Judy on the show. She gives us some great information on diabetes, keeps us up to date, what's happening with the Erie County Diabetes Association. Today on our program, we're talking about sort of the heading of our show is called Diabetes Alert.
Right.
Now, what is Diabetes Alert?
Okay. So there are 2 months out of every year that we devote big time to diabetes. One is March, one is November. In March, what we are trying to do is give people a wake-up call about the seriousness of diabetes and how, if you can avoid it, it's best to try to prevent diabetes rather than to try to live with it once you're diagnosed.
Okay. All right.
Now, I feel like a broken record because how many times have we addressed this? By and large, people still don't get it. So I want your viewers to take a second right now to close their eyes, if they will, when they're viewing this program, and envision a big clock. And in that clock, I want you to think about watching that second hand, and in 5 minutes, here's what's happening in diabetes in our world, and especially in our country. Every 5 minutes, 2 people are dying from diabetes complications.
Oh my gosh.
In the same 5 minutes, 16 people are being diagnosed with diabetes. Now, I know a lot of people aren't into numbers, but that's really a frank reminder to all of us when we say, oh, I don't have to worry about diabetes. It's not in my family. You may not think so because it's been so far back. It may be there. Let's just assume all of us are at risk, Judy. I think that's the best premise.
I think it is too.
Okay, so there's a new campaign this year along with the Diabetes Alert, which is called Diabetes STAT, S-T-A-T. Here's what it stands for. S stands for screening.
All right.
T stands for testing. And A stands for at now, at the time, today, action, today. That's what it is. So screening, testing, act, today. That's STAT. Now, we all have to start today to try in some little way to better our health, and especially when it comes to preventing diabetes. So that's just the numbers that are facing us. Now, an even bigger number is how many people are walking around today thinking, not a clue. I have no symptoms. We're going to cover those symptoms in just a minute. But they have a condition called prediabetes. 1 out of every 3 people in the United States, as well as right here in our community, 1 out of every 3 people have prediabetes. And 90% of them are tooling along with their everyday life and do not have a clue. So what's the biggie? It takes 7 to 10 years to get diabetes to come on full-blown before you're diagnosed.
All right.
Prediabetes gives you an excellent opportunity to prevent or delay diabetes to begin with. Again, maybe not too earth-shattering. There are no symptoms, by the way, of prediabetes. Nothing that's going to give you a warning. In a few minutes, though, we're going to be taking a little screening test together that people can take at home and say, wow, 7 questions. I'm going to ask you and I the question. You determine if the answer is yes or no. The viewers will do the same thing. Then that should tell them next thing I need to do is get actually tested.
Okay.
So, but let's talk about signs and symptoms too of diabetes. Diabetes is so sneaky. So you wake up today and you say, oh, I'm really feeling tired. I have no energy. I guess I didn't get enough sleep. Red light. Tiredness is not normal after you sleep all night, okay? Increased thirst. By that, I don't just mean, oh, I'm a little thirsty, I'll take a drink of water. It's like continually, gosh, I can't get enough liquid into me. Extreme thirst. If you drink a lot, what do? You run to the bathroom a lot.
Okay. Mm-hmm.
Okay.
All right.
The other thing is your appetite usually increases, believe it or not, but your weight may very well decrease. Now, people say, oh, I've been needing to lose a few pounds. That's good, I'm losing weight. No, these are the classic signs and symptoms are increased thirst, increased trips to the bathroom, extreme tiredness.
Okay.
Okay. So if you have some of those developing, and say maybe your vision is not as clear as it's been for some reason. Say you've got itchiness, generalized itching. Gee, I haven't changed laundry detergents. Start paying attention to what I call the little red lights that should come up.
Okay.
Now, if you're over 45 and you have a family history of diabetes, you ought to especially be concerned. So we're going to take the screening test next, if it's okay with you.
Okay.
So there's 7 questions. I'd like all of our viewers to have a little piece of paper in front of them, number it 1 to 7, and here we go with the questions. First question we're going to ask ourselves here, Judy, is are you a woman who has had a baby weighing more than 9 pounds at birth? My answer is no to that question. What's yours?
Mine is no.
Okay, fine. Number 2, do you have a sister or brother with diabetes? Or if they're deceased, did they have diabetes? Sister or brother?
Okay.
In your family?
I say no.
I say no also. So far, we're doing good. We don't have any risk, nothing to worry about.
No problem.
Number 3, do you have or did you have a parent with diabetes? Yes or no?
No.
No, for me too. Next one, question 4 says, find your height on the chart and your weight. I'm just going to give you a for instance. How tall are you?
5 foot.
Okay, you're 5 foot. Do you weigh 138 pounds? Give me a break or more.
No.
This chart is deliberately built up. Because folks may not have that chart accessible right now, say this to yourself. Am I at least 15 to 20 pounds over what my ideal body weight is?
And most people do know what their ideal body weight is.
Exactly, right. So
We
the
may not
answer
be
to you is you're not on the scale here. You have no overweight problem. I do not either. Okay. Number 5, are you younger than age 65 years of age and get little or no exercise in a typical day? Is that yes or no?
No, wait, okay.
It's not a trick question. What are you thinking? You're younger than 65.
I'm younger, but I
qualifies.
exercise too.
Okay, so this would be a no for you then, all right? Okay, and I'm not younger than 65, so it's definitely a no for me. Next question. Are you between 45 and 64 years of age? That's
Yes.
got to be a yes for you. That's a no for me.
Just by the skin of my teeth.
Just, yeah, okay. Question 7, are you 65 years of age or older? That's a yes for me.
That's a no for me.
Okay, so how many yeses do you have?
1.
1 yes. I have 2 yeses. Okay, now out of 7, to me, any yes question should make me more aware that I am at risk, especially for age 65 or older.
Okay.
Gosh, 1 out of every 20 people has diabetes in the over 65 age group. So that's extremely common. Our body is starting to wear out. It's not functioning as well as it had. So we've taken the screening test, and by the way, if you didn't have paper and pencil and you forgot some of the questions, 454-0715 is the Erie County Diabetes Association. Think that anytime you have a question or concern about diabetes.
Just call them.
Yes. Now, For those people that said, it's in my family, I'm overweight, I'm over 65, I get little or no exercise, red flag, red flag, red
Yes,
flag.
definitely.
When's the last time you had your blood sugar checked? When's the last time you had a fasting blood glucose done? You get it in your normal blood work,
Right.
probably once a year
Once
at
a
least?
year, I get that.
Okay,
I
do
was
you
trying to think of the last
remember
time.
what the number was?
Gosh darn.
I know it.
You know,
She thinks I
and-
pick on her, but it's
And you
not.
know, every time I bring the paperwork and I ran out without
yes.
it, but
What's it supposed to be? Let me ask you that first.
it's supposed to be under 100.
Good girl, exactly. Do you think, by and large, when you've seen your numbers, pretty much it's under 100,
It wasn't
or
100.
is it
It wasn't under 100. It was probably a little bit over. When I
little
say a
bit
little,
over.
I'm saying like
maybe
105
105 or something?
Yeah, 103.
And that tends to be mine too, although most of the time I run it in the 80s to 90s. Okay. All right. So if you're over age 45, you don't have a weight issue. Luckily, you're doing exercise of one sort or another.
Right, okay.
You still have to pay attention to that number, because if it's starting to get in what we call the pre-diabetes range, which is 100 to 125, get busy on what? In your case, to prevent diabetes, since you're low risk, you think, to begin with.
Right.
But yet your little fasting blood sugar is creeping up a little. What do you need to do?
Well, okay. Oh boy, see, do you see what she does to me?
Yes.
Okay, here's what I would do. I probably would be a little bit more concerned on what I'm eating.
Aha.
And making
Okay.
sure I'm not, wintertime, a lot of times I will have comfort food.
Okay.
Which is probably junkier food than I should be eating.
Okay.
More carbs, lots of carbs,
Okay. Now,
especially in the winter.
right, absolutely.
So I
Makes
probably
sense.
would say, oops, I haven't been having as many vegetables and fruits because it's winter. I don't seem to have as many fruits. I would be more careful on what I'm eating.
Okay.
I might say, okay, it's winter, I exercise, but it's certainly not what I do in the summer.
This is
so maybe
it.
I want to bump that up a little
There
bit.
you go. Exactly.
Did I do good?
Oh,
Did I do good,
excellent.
boss?
Here's my recommendation for you. Because you're at low risk, but your blood sugar is starting to go up, it indicates carbohydrates. And you're a carbohydrate
I'm a
eater
junkie.
like most people.
I'm a carb junkie.
If you, every time you eat a carbohydrate and your body breaks it down to sugar,
Right.
it needs insulin.
Yes.
But guess what? When the insulin comes out to balance your blood sugar, you tend to be getting hungry again because of the insulin being on board,
Okay.
and because you've eaten too many carbohydrates. If you could just moderate that a little bit
Just-
with your carbohydrate intake, eat more protein, okay, instead of the carbohydrate, it gives more staying power to that blood sugar. And it doesn't cause your body to be constantly asking for more insulin. That's what the problem is.
Right.
So with you, keep up what you're doing from an activity level, but try to moderate the carbohydrates.
And that's important.
Yes.
Your diet is so important.
Oh, it's extremely
to
important.
prevent diabetes and to
Right.
control diabetes.
Right, but if you could just practice, all of us, practice a little portion control on our plates. Not, you can't have this, you can't have that. Just section off your plate and say, more fruits and vegetables though, Judy. You got to work on that.
Right.
Absolutely, the research supports that. Lifestyle changes are the best way to prevent diabetes overall. But those are the hardest things to work on because we're creatures of habit.
And especially the older you get, the more it's hard to change habits.
It
you can
absolutely
do it,
is.
but it really is more difficult.
But if we had a donut sitting here in front of each of us right now, do you like donuts?
I would eat it.
Okay, so it would be really hard. Could we cut it in half immediately and say we're going to split this because both of us like carbohydrates? There's a way to do it. You're out in a restaurant, section off your plate when you get your whole meal and say, that's going home and this is all I'm working on. You can do it one step at a time, one few minutes at a time. It doesn't have to be this massive change, but it can make all the difference in the world.
And I think that was important when you talked about being in a restaurant. You can control, you can maintain wherever you are.
Yes.
Just because you're in a restaurant isn't an excuse. It's like, well, I'm out here eating dinner.
Yes.
You know, so.
Or I'm paying a lot of good money and I'm going to take advantage that I get a good service.
That's right. Or,
I'm not helping myself.
I'm going to do that pass.
Process.
Yeah.
You got
my
it.
pass ticket because I'm out. No, you can control no matter what, even on vacation.
Oh my gosh, there's a biggie too, right? Or, I'm stuck with, look, this is all they have. Okay.
And look at the bright side. If we go to the tropics, all the fruit and veggies we would have.
Exactly, right. You've got, very good, your attitude's changing already. So remember, the vast majority of people that we're trying to prevent diabetes are what are called type 2. Type 2 diabetes is typically the result of becoming too overweight and getting little or no exercise. And those are things that we can control. So get your blood sugar checked. Know it should be below 100. If you have diabetes, you got to know your ABCs. Do you remember what the ABCs stand for if you have diabetes already?
You will remind me.
Oh. Okay. So I put her on the hot seat, but that's okay. So A stands for A1C. If you're a person with diabetes, you must get that A1C checked because it gives you your average blood sugar over the past 3 months. Okay. B is blood pressure. 50% of all people with diabetes have a problem with high blood pressure and have to be on medication for it. C is cholesterol. So get your lipids managed also. Those are the ABCs. If you control those 3 things, I can assure you, you're not going to run into complications.
Okay. So you've got your ABCs, and that's with type 2 diabetes. I'm going to tell you something, though, Judy. Some of our viewers out there may have diabetes. They've been diagnosed with diabetes. They're older. They're a bit overweight. But they don't have the mobility so how do they exercise? How are they going to do that when
Get
they
some
don't
activity. Okay, if they're in a chair though,
Okay, yes.
they could. There's this little exercise thing for the feet that my
Okay.
brother uses
All
at
right.
home when he can't get out during
Okay.
the winter. You can just do arm movements.
Okay.
Just something to create some activity.
Okay, and that's
burning
what I
up some of
wanted to
those
point out
calories.
to people. I don't want them to say, well, I can't do anything because I don't have the mobility.
Right.
My legs are sore. I use a cane. You can still.
You could go to places like LECOM or the Y and participate in water aerobics. You don't have to swim, but they have excellent water aerobic classes for people who are not mobile.
There's something for everyone, no
Oh my
matter what
gosh.
their physical state may be, correct?
Absolutely.
Okay.
Right. Okay, so now I want to talk just for a few minutes, though, about type 1 diabetes.
All right.
Type 1 diabetes is indicative that there is not enough or no insulin being produced in the body. So if you don't have insulin being produced, you can't get the sugar into all your cells for energy. Most of the time, it most commonly occurs in children between the ages of 8 and 12. Okay, this next segment is for parents. There is a lot of misdiagnoses of type 1 diabetes in children. And here's what happens. My child may say, oh, I'm really thirsty, Mom. But every time you turn around, they're drinking. They have some of those classic signs and symptoms.
Right.
They're tired. They just don't have that get up and go like most kids do. So the parents tend to say, I'm going to watch this. Nausea and vomiting, maybe a little abdominal discomfort. Maybe if they cut themselves, they notice that it isn't healing.
Okay.
So what we need to do is get the child to the pediatrician. Now, if you have flu-like symptoms, which is a lot of times how kids present with what may end up to be diabetes. They go to the pediatrician says it's just the flu. What you ought to demand as a parent is that the urine in the office is checked for ketones.
Oh, okay.
When your body can't use carbohydrates for energy because of the lack of insulin,
All right.
you start to break down fat in your body, and the breakdown of fat results in ketones in your urine.
Okay.
That can be a very big chemical imbalance in the body that we have to pay attention to. So speak up on your child's behalf.
Okay.
I think the Erie County Diabetes Association is underutilized in this community. We don't get the calls from people who are newly diagnosed and saying, now what do I do? I don't know what I can eat, what I can't eat, how I exercise, what medicine I have to take. 454-0715. We have a website. It is diabeteserie.org. We have really great programs on preventing diabetes, so you can ward that off. Or we have one-to-one coaching by our nurse to help you if you already have diabetes and you're struggling with some barrier. Okay. We especially reach out to people who are underserved, uninsured or underinsured. So we're there, but people do not take advantage of us enough. And these programs are wonderful because they're shown on YouTube. They're shown on the Millcreek government channel. We show them on Channel 2, the other cable access in Erie. But the message still isn't getting out, Judy. So whatever we can do, please give us a call.
You know what I think? I think a lot of times when someone is diagnosed with diabetes, and this is just me thinking this, and maybe some of you viewers are facing this too. If you're diagnosed, you get a brochure in the doctor's office.
Yes.
And you think, well, this is all there is that I have to know.
Oh my gosh, yes.
But if you would go to their website, again, diabeteserie.org, I check it out quite often.
Yes.
Because you always have something new going. There's a new program. There is help. Again, a lot of times people are afraid to call and ask a question because they think they're going to sound foolish.
This is it. Exactly.
And I'm going to tell you something. There is no foolish question. When it comes to your health, I am sorry.
Gosh.
I'm not the expert on everything here.
This is it.
You know,
yes.
For diabetes, you guys are.
Yes.
And I'm going to come to you and I am going to utilize those services. And they're free.
Well,
just
by and large, absolutely.
Most of them, I mean,
we certainly welcome donations from the community.
But this is where I wanted to go.
Going.
This is why they can offer this, because of donations and volunteers.
And we need volunteers a lot. Clerical volunteers or just people for any number of reasons.
Right.
You name the time, we can slot in what we need your help with.
And you guys are local. We have local people right here.
This is
a local number. Just call.
Right.
They can help you.
Right.
You know, put you in. And also, I think in some of the meetings or the programs, you're meeting people that are in the same boat as you.
You got it. Yeah. Don't feel like you're isolated. I'm the only one. Or don't get in the denial game, which is, oh, yeah, I'm tired, but I worked hard the past few days. No, don't try to justify. Pay attention to your body because it's trying to give you signs that it wants you to
And if you're diagnosed with diabetes too, again, it's the denial. It's like, oh, no, that's not me. That number's not bad.
No,
I'm
that's
fine.
not correct. Yeah, the lab better do it.
No, that's not me. I don't have it in my family.
Judy.
There's no way it's me. This is where the Erie County Diabetes Association is so helpful, and they're so informative. And I'm going to tell you, what a great group. They are an absolute wonderful great. They're such an asset to the community.
Yes. So keep us in mind, even if you want to email us, if you have an email, you know, if you go to the website, it'll give you the exact email to get in touch with. You can walk in the office. We're located on 12th and State Street right now. We may be relocating in the future, but for right now, absolutely. But 454-0715 is absolutely the number to remember.
Okay, now this little test that we did, we've had it up on the screen, and you and I have taken it. If someone, of course, did not have a piece of paper or
Yes.
anything, or they want to give it to a different family member,
Absolutely.
how do they get a hold of
They
this little
can
quiz?
get a hold of it on the website itself.
right.
We have it there. Can call our office. We'll go over it with you on the phone.
Okay.
And discuss what you can do about those risk factors.
Okay. And just because you only had one yes, like some people,
Oh, yeah.
Here.
Don't get in that game. Yes.
Yeah, you
Thinking
still
you're at
have-
low risk.
you still
Pay
have
attention
to be
as your
careful.
age goes up.
and
Yes.
you know what? And I just think in this day and age, the numbers that you talked about earlier,
Yes.
it's alarming.
It is
It is
alarming.
alarming. This is an epidemic, people.
It is. Right.
So right here in our own backyard, you can get all the information, everything you ever needed to know to prevent and to control, and to even for family members.
Right.
You know, you don't have to be the person with diabetes.
You got it. And also keep us in mind, we have an emergency supplies program for people who are uninsured.
Right.
If you have a loved one that passes away and they had diabetes supplies that are not used, they're in the original box, they're not expired, call us up. We'll make arrangements to pick them up from you or bring them to the office. Another small way to help.
You guys are great. Judy, thank you so much for joining us.
You're welcome.
It has been a fast half hour here.
So I don't need to come anymore to talk about diabetes. We've covered it all, and people are going to change their behavior, right,
Well, that's
Judy?
a nice try. But that's not going to happen.
Okay, I guess I'll be
I'm always
back.
going to have you on the show, Judy.
Okay.
All right, viewers, if you have any questions, if you want to learn more about, how to prevent and control diabetes, please give them a call. Check out the website. Again, viewers, thank you so much for tuning into the Millcreek Government Channel. And until next time, have a wonderful day.
You're watching the Millcreek Government Channel, powered by WQLN Public Media.